Dr. Rose, what are some of the more common fractures that you deal with?
Well, what hand surgeons typically are asked to address are fractures that involve a joint surface, the bone that supports a joint surface, or when multiple bones are fractured in the upper extremity. Orthopedic surgeons are very skilled at addressing some of the more common sort of shaft fractures and such, and typically the things that they ask us to see are those particular fractures that are surrounding joints, or if there's multiple fractures that are involved. Typically fractures can be treated conservatively with either a splint or a cast, sometimes in a sling for a short period of time. However, sometimes they do require surgery, and if surgery is required, sometimes that involves just putting in temporary pins after what's called a closed reduction is performed, and that's where under an anesthetic and utilizing the moving x-ray machine that we have, a device called a fluoroscopy, where we pull the bones back into alignment. We use these temporary pins to hold the fractures in place. Or sometimes we formally have to open the skin up, get down to the bone, and realign those pieces that have been broken, kind of putting back together the jigsaw puzzle. But when we do that, often we'll put in plates or screws, and the nice thing about the plate and screws, with it being fully contained, is it's a very strong construct, which allows earlier rehabilitation and often shortens time in immobilization devices like splints or casts. Now, I do want to point out that with the small joints of the hand and the upper extremity, they often get very stiff from all the swelling that will occur. There's not a lot of room for give in the upper extremity, and again, that's why we have our specialty in order to be able to help overcome some of these things. That stiffness from the swelling can often lead to scarring around tendons, and both of which can lead to limitations in joint motion. And we work hand in hand with the occupational therapists, who are the physical therapists for the hand, in order to be able to minimize any limitations that might develop. So that's really what we do as hand surgeons, is to try to limit the functional loss that you have after having an injury in your upper extremity.
Do you see a lot of sports upper extremity injuries from sports-related activity?
We see our share of that, and there are sports-related things that involve ligamentous injuries, certainly fractures, and sometimes even tendon disruptions. So we do see sports-related problems in the upper extremity as well.
Thank you, Doctor, very much.